The UK's Prime Minister Boris Johnson has spent the night in hospital, where he was admitted for tests 10 days after being diagnosed with coronavirus. Downing Street says it's a precautionary step as Boris Johnson continues to show persistent symptoms of the virus. He remains in charge of the government, but the UK's Foreign Secretary Dominic Raab will chair this morning's coronavirus meeting. Scotland's Chief Medical Officer has resigned after being criticised for visiting her second home twice against her own lockdown advice. Scotland's First Minister, Nicola Sturgeon, initially defended Catherine Calderwood before agreeing that the doctor's behaviour risked undermining confidence in the government's public health message. Elsewhere in the world, the US has had more than 9,600 deaths confirmed. The country's Surgeon General warned people that the coming week will be their Pearl Harbor or 9/11 moment, with deaths from COVID-19 expected to peak. In Asia, reports from Japan say the government's preparing to declare a state of emergency as cases there continue to rise. In Tokyo, the number of cases has doubled over the past week to more than 1,000. Good news from South Korea, which has reported fewer than 50 new cases, its lowest daily total since the outbreak there peaked in February. The rate of infection has been dropping for weeks. Our first report on the situation here in the UK, where the PM has been in hospital, comes from our political correspondent, Chris Mason.
The man charged with leading the country's response to this virus is experiencing the unpleasant reality of it. It was a week last Friday that we heard the Prime Minister had coronavirus.
Hi folks, I want to bring you up to speed with something that's happening today, which is that I've developed mild symptoms of the coronavirus, that's to say a temperature and a persistent cough. And on the advice of the Chief Medical Officer, I've taken a test that has come out positive. So I am working from home, I'm self-isolating.
Number 10 made it clear Boris Johnson would continue to work remotely from his Downing Street flat, and he chaired what he described as the first ever digital cabinet meeting from self-isolation. Last Thursday night, he joined millions of others in expressing his gratitude to those working in the health service.
OK, thanks NHS, thank you. Thank you, thanks all. Thank you.
But it was clear in another post on Twitter on Friday that he was still unwell.
Although I'm feeling better and I've done my 7 days of isolation, alas, I still have one of the symptoms, a minor symptom of I still have a temperature, and so in accordance with government advice, I must continue my self-isolation until that symptom itself goes.
Last night, Downing Street issued a statement. On the advice of his doctor, the Prime Minister has been admitted to hospital for tests, a spokesman said. This is a precautionary step as the Prime Minister continues to have persistent symptoms of coronavirus 10 days after testing positive for the virus.
I want to express our nation's well wishes to Prime Minister Boris Johnson as he wages his own personal fight with the virus. All Americans are praying for him. He's a friend of mine. He's a great gentleman and a great leader. And he's, as you know, he was brought to the hospital today. But I'm hopeful and sure that he's going to be fine. He's a strong man, strong person.
Boris Johnson has spent the night not here, but in hospital. His officials are adamant he is still leading the government's response to the pandemic. But this virus is crippling the economy, robbing us of our usual liberties and straining the personal capacity of the Prime Minister to respond to it on our behalf. Chris Mason, BBC News.
Let's talk to Norman, our assistant political editor, who's at home. So why has he been taken to hospital, and can he continue to lead the response to the pandemic?
Well, we're told he was taken to hospital not because there'd been a deterioration in his conditions, that coronavirus had become more severe, but simply because of the longevity of the symptoms. He was meant to be ending self-isolation on Friday. That didn't happen, and he still seems to be suffering from a temperature and a cough. And so, on the advice of the doctors, he's gone into hospital. It wasn't Boris Johnson saying, I think I should go into hospital. The doctor said, no, come in. we'll run some tests, we'll take a look at you face to face, and we'll decide what to do next. What we don't know, obviously, is the outcome of those tests. I think we'll get more information later this morning. And on that, I presume, will depend whether Boris Johnson returns to Downing Street later today, or indeed whether he has to spend longer in hospital. Now, if it is the latter, then that begins to raise question marks about, well, how does government function? Because although obviously Mr. Johnson can phone from his hospital bed, he's, at one remove from direct hands-on control. So today's COVID Cobra meeting will be chaired by Dominic Raab, but people are beginning to have to turn their minds to what happens if the PM really has to spend a few days in hospital, and then if the medics say, and once you get back to Downing Street, you're still going to have to rest and recuperate. You could be talking about quite a few days when alternative structures have to be put in place, albeit the Community Secretary, Robert Jenrick, said so far the Prime Minister was looking okay.
Today he's in hospital having the tests, but he'll continue to be kept informed as to what's happening and to be in charge of the government. And as I say, I hope, I think we all do, that he has a speedy recovery and he gets back to number 10 and can take charge in the way he would want to as soon as possible. I'm sure this is very frustrating for him, somebody like Boris who wants to be hands-on running the government from the front. But nonetheless, he's still very much in charge of the government.
Community Secretary Robert Jenrick. Norman, presumably there are the big brains of Downing Street and elsewhere in government now working on how we get out of partial lockdown.
Well, yes and no, I think, is the honest answer. Of course, it's the question everyone wants to know the answer to, how we get out of lockdown and how we get out of this whole crisis. I think the honest truth is we don't know yet. And the reason we don't know yet is we've not reached the plateau, this curve we keep talking about every day of the new hospital admissions and new hospital infections. We want to slow down the rate of increase so it begins to curve the other way. Once it reaches that sort of plateau, then what the scientists will be looking at is whether we're getting a fast descent. In other words, it's really dropping very dramatically, or we're into a much shallower plateau. If it is the latter, then I would suggest the likelihood of an early release of the lockdown begins to recede some way into the distance. As the sort of thinking on the exit strategy goes, I mean, I think we are really quite a long way off that. Certainly, Professor Neil Ferguson, who's been the sort of chief modeller for the government from Imperial College, was saying quite candidly, I thought at the weekend, look, we do not have a precise exit strategy at the moment, and it all depends really on how far we manage to flatten the curve and how far we can push it down before we can start thinking about ending the lockdown and then working out an exit strategy. So we are in a curious lull at the moment. Everything is focused on just trying to bear down on the death rate and on new infections. That is the immediate and total focus. So in a curious sort of way, politically, there aren't that many big decisions that have to be taken now. The big decisions, mainly, it seems to me, are by the scientists, the officials on the front line, NHS staff, and the day-to-day struggle in trying to just keep those numbers down. The big decisions on lockdown and exit strategy, some way off, and one would hope Boris Johnson would be fully recovered by then.
Cheers, Norman. Thank you.